The TROPHY-U-01 trial is a phase 2 trial in patients with advanced urothelial carcinoma. It's designed to occur in two cohorts. One cohort is for patients that have had cancer progression despite both platinum-based chemotherapy and immune checkpoint inhibitor therapy. And then exploratory secondary cohort is for those that are cisplatin unfit that have cancer progression despite immune checkpoint inhibitors alone and or other therapies. What we presented were the interim results of cohort 1, which is the prior platinum as well as immune checkpoint inhibitor cohort. It was designed as a two-stage study with initial 35 patients with a futility analysis, and we presented that interim analysis. To back up, Sacituzumab govitecan, or IMU-132, or now SG for short, is an antibody-drug conjugate directed against the TROP2 antigen. TROP2 is overexpressed in a number of different epithelial tumor types, including approximately 90% of urothelial carcinoma. So that antibody-drug conjugate takes the toxin SN38, which is the active metabolite of irinotecan, to the tumor cells and in the microenvironment around the tumor cells and releases in that area. We did a prior study, a phase 1-2 basket study, where 45 patients with metastatic urothelial carcinoma heavily pretreated were presented earlier this year at the 2019 Genitourinary Cancer Symposium, where in heavily pretreated patients we saw a 31% response rate. But we wanted to design a specific trial for urothelial cancer patients, and this is the interim results of TROPHY-U-01. So in this study, we enrolled 35 patients. They were predominantly male, predominantly white. About 2/3 had visceral metastases, about a quarter had liver metastases, and this was a median of 4th-line therapy for these patients with a range of 3rd to 7th-line therapy. In terms of efficacy results, we saw a 29% objective response rate, very similar to that previous 31% response rate. It's fairly early data, so we don't know what the progression-free overall survival is, but 8 out of 10 responders were still responding at the time of the data analysis. And during the presentation, I showed swimmer's plots as well as a spider plot that showed that most of the patients that were responding or stable were maintaining that over at least one additional scan, and it was a median follow-up of 4.1 months. The adverse event profile is very similar to what we've shown before in urothelial carcinoma as well as other tumor types, with the most common high-grade toxicity of neutropenia. About 2/3 had any grade neutropenia, 11% had febrile neutropenia. And the second adverse event, most common, is 57% had any grade diarrhea, although grade 3 was in the single digits, so quite low. And in the grade 1 and grade 2 diarrhea, generally was not persistent, so lasts typically a couple of days per dose or per cycle. So it's not like the average subject has to endure grade 1 or grade 2 diarrhea for the entire duration of treatment. So in summary, we saw very encouraging results. We surpassed the futility boundary, so the enrollment in the trial continues. It's around 3/4 enrolled, and we hope to enroll the last quarter in the main cohort and then analyze the results next year. The other cohort of cisplatin unfit patients is nearing the halfway point in terms of enrollment.